Hi, my name is FeliciaGretah. I'm a radiation therapist from the Cleveland Clinic, Florida in Weston. We've been using AlignRT for about 6 years, and with it we've been able to enhance our workflow and benefit from its advantages. So today I'd like to share some examples of how we're using the system and how we've gotten faster, specifically by using the postural positioning feature. So we are the first Cleveland Clinic satellite outside of Ohio. We've been open for 6 years, and we have an edge and a true beam. And in this time, we've seen a lot of growth. Through it, we've brought on new technology, new equipment, and new techniques, one being AlignRT, which has contributed to our ability to grow without stressing our resources. Here you can see how our growth has increased over the years. In our first year, we started 444 new start patients, 60 of which were special procedures. And the following year, in 2016, we began using Vision RT for only SRS procedures. Our third year saw a decline because a radiation oncologist left, but the lower patient load gave us an opportunity to focus on Vision RT and incorporate it into our workflow and see how we could benefit from it. So we started rolling out a few more areas of the body, and we chose head and necks and pelvises. So by our fourth year in 2018, in addition to the head and neck and pelvis patients, we began using Vision RT to replace the spirometry system we were using for DIBH breasts. And out of 131 new start breasts, 21 of those were Vision RT. We also treated about 43 SRS patients that year. By 2019, we were fully utilizing the system, and so we were doing it for all treatments on every fraction. And with this, we were able to treat 845 new starts, 200 special procedures, and 148 breasts, of which 29 were DIBH. And we were able to do that without extending our schedule or treatment times because we were just able to complete these procedures much more quickly. And then last year, we began using AlignRT Advanced with the postural positioning feature, and that allowed us to be even faster. And so with that introduction, we were able to facilitate 78 DIBH breath hold patients, again, without straining our resources or extending our treatment times. So one area where we've had significant benefits from AlignRT are with our head and necks. We immobilize with a few different devices. Generally, it's a custom head pad with a 3 or 5-point mask. We do also have a double-sided positioning shell that allows us to cradle the head, and we use that for all of our SRS treatments. With either system, though, we always look for the same things. We want to make sure that the mask is open to about the side of the temples, to about the tragus, and to about the mid-forehead, right above the brow bone. And this allows us enough area to track to get a good roll, rotation, and pitch reading. So then we're ready to define our ROI. So we're going to cover the portion that we left open when making the mask, being sure to be generous on the sides, giving it enough of a reading so that the system can track it accurately, but not overlapping into the mask. Luckily, we had some wonderful patients who wanted to participate in this video, so we're able to show a real-time setup of the head and neck. So here we have the postural positioning video feature, and we can see a really nice outline of exactly where the patient needs to be, and in conjunction with the tolerances. So he's going to have her move her nose up. You saw it fall right into place on that contour. He's going to really focus on getting these rotationals to be in tolerance, and then place the mask to fine-tune and adjust the translationals. And as the mask is snapped down, we'll see everything fall into line really, really nicely. And so this is a little different from the older version because now you can actually see where everything needs to go instead of just looking at the numbers and trying to figure out exactly how to move the patient. So once everything is as close to 0 as possible, they're going to grab some SSDs, and then they'll be ready to image. And so from the imaging, we can see that everything looks really well aligned. The shifts are very minimal. And that took, probably a few more minutes than just snapping a mask on, but we have so much information with this, and we're able to really get that pitch, rotation, and rollout as well as possible, so that we may be spending a little extra time on the front end, but we're not repositioning and re-imaging, so we're saving a lot of time on the back end. Another area where we've improved our time and workflow are for DIBH breaths. So at the time of SIM, the patient is either positioned on a breastboard or in a body fix, and then they're coached to take a slow, steady, deep breath in through their nose, being mindful to fill their lungs with air and not their abdomen. And then what we do is we take our lasers in the SIM room and draw a free breathing line and a breath hold line on the patient. So what we want to do is when they take their slow, steady breath in, we want to see where they're able to breathe into, and then we use this as an indicator of how significant their breath was. It'll give us an idea of the separation we're going to see on the CT scan, and then it gives us a marker to track whether they're able to take that breath in to that line every time. So once we have coached them a few times, we'll do 6 breaths, ensure that they're able to hit that line and hold it for about 20 seconds without losing any air or trembling or arching their back. And once we're satisfied that they're able to do it and the patient is comfortable with the process, then we do our CAT scans. So we take 2 scans of free breathing and a breath hold so that we're able to align the patient in a free breathing position first, and then fine-tune them in the DIBH position on the treatment machine. So then we're ready to define our ROI. So we find we get the best readings when we cover the entire affected breast and as much of the mediastinum as possible to incorporate that stable structure. We're careful not to go too much into the axillary area or incorporate any areas where there's significant adipose tissue. We also found that adding a little strip under the breastbone and slightly onto the abdomen on the unaffected side helps us get a really good reading with the rotation and roll. So here is the setup for the four-field breast. We see that they are starting in the free breathing position, and the therapists are moving the patient in, uncovering the area to be treated. You can see that they're paying particular attention to the video feature where her arm position is, her abdomen, the tilt and positioning of her chin, which will be so important to how that supraclav sets up. Once they have her as close to 0 as possible in free breathing, they're going to toggle to her breath hold position. And then they can coach her into her breath hold, looking at that yellow line in the coaching bar, as well as her anatomy. And she lines up so nicely, so they can go ahead and grab their SSDs, and then they're ready to begin their imaging or treatment. And so that hold setup took less than 60 seconds. It was pretty quick to get her where she needed to go. And so now we'll have that patient take those breaths in again, and we'll see how they align so nicely. She was able to do that really well. You can see as her body settles from that breath hold, she goes almost very close to 0. They're going to have her do it one more time to ensure that they can start the treatment and imaging. And so she takes pretty exaggerated breaths, but you can see again how her body settles right back in, and that just takes time to get to know the patient, working with them on the coaching. And once she's into position, they'll take some images so we can see how this aligns. And there you go. Those are the images. Supraclav is on, that humeral head is in position, ribs look great, the abdomen looks great, shifts are 0. So that looks beautiful. They can treat it. You know, these procedures used to take us anywhere from 30 minutes to an hour, and now we can do them anywhere from 15 to 30 minutes, depending on how many fields we're treating, which is a huge time improvement for us. So with the old version of Aligner T, it was a little bit more tricky to track the breast and where it needed to go, especially with those soup post move. Now we can really see where everything needs to get aligned, especially the arm position. And so it was difficult to track that simultaneously with the breast in the old system. Now seeing that real-time movement of it in video feature is a huge improvement. The last example is an extremity, and sometimes we find that extremities can be difficult to immobilize well and then recreate that on the treatment machine. So here we have a right knee. We immobilized that in an indexed body fix, and we wrapped the body fix around her foot, but we were careful to leave the sides low so that we'd have a surface area on her leg to track with Aligner T. So then we're creating her ROI, and we're tracking the anterior portion of her leg, as well as a little on both sides. We're careful not to go too low with the ROI because we don't want the unaffected leg blocking it or the vac bag on this lateral side of the knee. So here's the setup of that knee. The therapists are moving her into tolerance. And with the video feature, we can see the exact outline of where everything should be positioned. And so you can see that there's definitely a lateral move that needs to happen, probably a roll and a rotation. And after they get everything covered except for that area, they can start using that information to position her. And so with just that one move, they were able to almost get her into tolerance. And now, even though they're in the green, they're going to make a few little adjustments to just try to get these rotations as close to 0 as possible. You can see here they're really trying to work on getting that rotation out. And then you see that that move really took care of that. I'll make a few little minor adjustments. They're as close to 0 as they're going to get, so they can obtain their SSDs. And then they'll image. And from the images, we can see that there is no rotation or roll needed. The shifts are 0. It looks so beautiful. This patient was able to set up well every day. She never needed to be re-imaged or repositioned. So just like the head and necks, it takes a little bit more time on the front end, but we're using that information to really save time with having to re-image and reposition the patients in the long run. So as you can see from those examples, there was definitely a time and accuracy advantage with implementing the Aligner T Advance, especially with the postural positioning element. So again, it's helped us increase our patient volume without extending our hours or straining our resources, and we're still able to maintain a very high level quality of care while keeping our patients comfortable. Thank you so much for your time, and I'd like to say a quick thank you to our physicians and physicists and therapists who made this presentation possible. Thanks again.